This is the brief on the intubation pressor response, brought to you by Whole Life Healthcare. And a huge thanks to Quebec, our amazing cardiac tech, for today's info and your hard work in cardiac care. So placing a breathing tube absolutely saves lives, but it actually triggers a violent, involuntary spike in heart rate and blood pressure. Imagine your body's emergency alarm system going off all at once just because a foreign object touched your vocal cords. How do we stop this false alarm from wrecking the house? First, the cause. Airway stimulation causes a massive sympathetic dump of endogenous catecholamines. This triggers severe hypertension, tachycardia, and risky arrhythmias in literally seconds. So what does this sudden massive surge actually do to a vulnerable heart? Second, the danger. A healthy person tolerates this brief stress spike just fine. But for high-risk patients with severe preeclampsia, cardiac disease, or raised intracranial pressure, it can cause myocardial ischemia, pulmonary edema, or a cerebral hemorrhage. Think of it like revving a car engine to the red line. A brand new engine handles it fine, but an old or damaged engine might blow a gasket. Finally, the solution. We blunt this surge using specific meds right before intubation. Labetalol blocks receptors, fentanyl decreases sympathetic tone, and propofol depresses airway reflexes. It's a delicate balancing act, giving just enough medication to block the dangerous stress reflex without completely crashing the patient's baseline blood pressure. Mastering the pressor response means anticipating the body's extreme reflexes and neutralizing them with the right medications before the breathing tube even goes in. Grab our EKG Survival Pack, subscribe on YouTube, and find this instant classic on Spotify. Next time you see a patient's vital spike during an airway procedure, ask yourself, did we prep the engine before we redlined it?